A recent study has uncovered a shocking link between obesity, menopause, and a deadly form of breast cancer. But here's where it gets controversial. It's not just about estrogen, but a specific type called estrone. Postmenopausal estrone and obesity, a dangerous duo. The research, published in Nature Reviews Endocrinology, reveals that estrone, the primary estrogen in postmenopausal women, is the culprit behind the inflammation, growth, and spread of estrogen receptor-positive, ER+, breast cancer. This is particularly true for women with obesity, where estrone levels skyrocket in adipose tissue, creating a perfect storm for cancer development. Before menopause, the hormone 17-estradiol takes center stage, produced by the ovaries and acting as an anti-inflammatory agent. However, after menopause, its levels drop significantly, allowing estrone to take over. And this is the part most people miss. Estrone, when synthesized in adipose tissue, increases with fat mass, leading to a 2- to 4-fold rise in levels in obese individuals. The obesity-estrone connection. Obesity itself is a state of chronic inflammation, with adipose tissue expansion and the activation of nuclear factor B, NFB, causing a surge in pro-inflammatory cytokines. The study highlights that estrone, being the dominant estrogen post-menopause, is also pro-inflammatory. This means that in obese individuals, the increased adipose tissue mass produces more estrone, fueling NFB-driven inflammation. This shift from anti-inflammatory 17-estradiol to pro-inflammatory estrone might explain why ER+ breast cancers are more common in older women, even though overall estrogen levels decrease. Interestingly, ER+ cancers account for over 70% of breast cancers in women over 70, with incidence and mortality rates climbing after menopause. Unraveling estrone's role. Despite its dominance post-menopause, estrone's role has been relatively overlooked. Dr. Joyce Slingerland's research at Georgetown University's Lombardi Comprehensive Cancer Center has shed light on how estrone, along with NFB, triggers inflammation, expands cancer stem cells, and encourages invasive behavior. A 2022 Cell Report study further demonstrated estrone's ability to promote metastasis by activating epithelial-mesenchymal transition (EMT) gene programs. Obesity and estrone, a lethal combination. The study suggests that this process is exacerbated in obese, postmenopausal women. Their higher adipose tissue mass produces more estrone, and chronic inflammation intensifies the interaction between adipocytes and cancer cells, accelerating tumor progression. The authors believe this could lead to the development of invasive features, local invasion, and metastasis. Clinical implications and controversies. These findings have significant clinical implications. Dr. Slingerland suggests re-evaluating cancer treatment approaches for these women, especially considering that weight loss interventions could reduce estrone's pro-inflammatory effects. GLP-1 receptor agonists and dual GLP-1 GIP agonists, known for their weight loss benefits, could be explored as adjunct therapies for ER+ breast cancer. But is targeting weight loss enough? Should we be focusing more on estrone-specific interventions? The study's authors propose investigating the enzymes regulating estrone and estradiol, but what are your thoughts? Is this a breakthrough in understanding breast cancer, or is there more to uncover?